Clinical Pilates Physiotherapy is an ideal rehab and prehab tool to help runners become faster, stronger, and stay injury-free. Many common running injuries come from chronic overuse. Clinical Pilates Physiotherapy addresses this issue by first looking at your muscles' activation patterns, and then also looking at your body alignment. In a session, a clinical Pilates physio will use this assessment to then use manual therapy techniques as well as Pilates-based physiotherapy exercises to create a program perfect for you to optimize your running mechanics. Most runners overuse their hamstrings and underuse their glutes. This next exercise is really important because it helps activate your glutes prior to a run. You need your glutes because they are the powerhouse to help you drive forward when you're running and up a hill. You want to use this just before a run, and you're going to do 10 repetitions on each leg. Find a wall or a bench or any hard surface that you can prop your foot up against. Engage the core, keep the hips level, and then slowly press the back knee straight and then bend it. When you're straightening, you're trying to get your glute or your major bum muscle to activate. You should feel it fire instead of your hamstrings. The reformer is a great tool to improve the stability of the core, hip, knees, and especially the foot and ankle. Having a stable base in the foot and the ankle is really important for runners. This next exercise, called high half toe, the feet are on the bar, and you want to keep the toes planted on the bar and lift the heels. Keeping the heels lifted, straighten the knees, and push yourself away. As you fold back in, think about keeping those heels lifted and not letting them drop. Keep all 5 toes connected on the bar, especially your big toe. Make sure that you've got a connection between that big toe mound and the bar. On the reformer, we can activate our glutes by doing a position called sleeper. In this position, the patient's lying on their side and their foot is up on the bar. They're going to engage their core first, and then they're going to use their glute to push them straight, trying to get the full leg into full extension or full straightening. At this point, they should feel their glute activate as they hold it at the top for about 1 breath and then slowly sink back into the knee bend. Using the glute instead of the hamstring is really going to prime the body to know to use those muscles when you're out on a run. Improving core stability will help runners of all levels by creating a stable base to let their legs spin with ease. This next exercise, called circles, can be done on the reformer with feet and straps or at home without straps. If you're doing it at home without straps, you'll see that the circles are much smaller. Think about the movement coming from your core. You want to have a nice neutral spine in this position, so always check in to make sure that your ribs or low back aren't popping off the ground. If they are, it probably means that you're doing too big of a movement. So start with a smaller movement and then slowly increase the distance. You can also do the circles in both directions. First direction, their feet are going to go down towards the floor first and then circle back up to meet together. The other direction, they're going to spread apart first and then go down to the floor to meet back in the middle and rise up. This is a great exercise to do at the end of a workout, and core stability can gradually be improved on over time. Visit our website at www.trelorphysio.com to book your one-on-one clinical Pilates session today.